677. And again, I would make note the hour of the night, so brevity and focus is always appreciated.
Yes, thank you.
Especially in talking about a subject such as gloves in restaurants, something I have some familiarity with.
Right, all right. Well, just one little piece of information. While you were debating PrEP and PEP, the improbable happened again. Los Angeles Clippers 129, Golden State Warriors 121. So...
I'm sorry, no demonstrations, but you can. Yes. Thank you.
LA is in the house tonight. So I first want to just thank the committee staff for working to improve this measure, and I'm very happy to accept the amendments listed in the analysis. Now, this is a simple but important measure. Based on laws in 6 other states, SB 677 prohibits the use of natural latex gloves in restaurants and other food facilities. Now, how do we get to this place? Well, incidents of latex allergies are increasing with an estimated as many as 6% of people in the United States diagnosed with the allergy, including up to 17% of healthcare and food service workers and 11% of the elderly. Workers who use latex gloves are at higher risk for developing this allergy because the more a person comes into contact with latex, the greater the risk. For those suffering from this allergy, even trace amounts of natural rubber latex can be deadly. An allergic reaction can be provoked by touching a product containing natural rubber latex, inhaling airborne latex protein particles, or eating food prepared using latex gloves. And I'll say, actually, our friend who's up here from the district has already had 2 EpiPen injections today alone. We had a lot of moms with a lot of baby materials and latex materials, and I'll just to illustrate the problem, she went over to Chicory, which used to be latex-free, thought it still was, and had an emergency because apparently they've started using latex again. So the symptoms can range from hives and rashes all the way to life-threatening anaphylactic shock. Now here's the thing. I would not be coming to this bill if there wasn't reasonable alternatives. And Cleveland Clinic, Sharp Memorial, Long Beach Memorial, Johns Hopkins have been coming up with safer materials. And in fact, U.S. HHS, Department of Health and Human Services, Center for Disease Control and Prevention, and the NIOSH, the National Institute of Occupational Safety and Health, recommends that workers use non-latex gloves for activities that are not likely to involve contact with infectious materials, such as food preparation. And where existing law requires gloves to be used, alternatives such as nitrile gloves offer the same or better protection and are more often than not cheaper. So since introducing the measure, we've had a massive outpouring of people contact our office to share their latex stories, the latex allergy stories. We have a stack of letters from individuals writing in support, plus a change.org petition. We've have nearly 1,000 people who've written in just unannounced. Most folks, including Oliver, one of my constituents whose mother's here, who brought this issue to my attention, couldn't attend today's hearing, and his allergy is so severe that the unknown amount of latex that could potentially be present due to the crowds here today for today's hearing would have been too dangerous. So here's the thing. We have alternative gloves that cost the same or less than latex while offering the same protection. Many restaurants have gone latex-free. We really do want to protect people like Oliver. And to speak in support of the bill today, I have Dr. Travis Miller, an allergist from Sacramento, and Kristen Shih from Santa Barbara.
Okay, before we take on the witness, I just want to clarify, I appreciate your willingness to take amendments, except we had no amendments to offer, and we were willing to address the bill the way it is. So as long as you have no problem with that, we're good with that. Okay, witnesses support, you have a maximum total of 6.
So amenable.
Yes. Okay, so we have a total of 6 minutes for all the speakers. This is late hour. If you can keep it briefer than that, we'd appreciate it. Please begin.
Good evening. My name is Travis Miller. I'm a practicing allergist here in town. I'm representing over 500 patients of mine who have latex allergy. I'm also the past president of the California State Allergy Association. That represents 200 of the allergists in the state of California. I'm the Speaker of the House of Delegates of the American College of Allergy, which represents 6,000 allergists. Allergic disease is a public health crisis. It is an epidemic. Latex allergy is one of those. New data actually shows that the number of 6% may actually be higher. There's numbers published in 2016 that show that number might be as high as 9.7%. So we're just seeing an explosion of allergic disease, including latex. SB 677 amends a very important health code. These codes are in place to protect citizens and patients. It's simply not acceptable to leave 10% of our patients who are hypersensitized, exposed, and vulnerable. I argue there's no other code that would allow that amount of exposure to patients or consumers. SB 677 simply seems like a win-win as safe alternatives are available, and I'll cede my time.
Good evening. My name is Kristen Shee, and I'm from Santa Barbara, California. I am here to tell you about my family's experience living with and losing loved ones with latex allergy and advocate for us and others at risk for latex exposure. My sister Kara and I both developed latex allergies while working in the medical field, being exposed to latex gloves. 3 of my 4 children all have the same devastating, life-threatening latex allergy. Having an allergy to latex is life-changing. We must avoid any contact with latex. We can't touch it. We can't be in the room with it. We can't eat food prepared with latex gloves. And we always carry emergency kits containing Benadryl, inhalers, and EpiPens. We carry them on our person every day, every minute. If we were to eat in a restaurant that used any form of latex gloves, we could experience life-threatening allergy reactions. My sister Kara was a registered nurse, and her allergy became deadly, and she tragically died from latex allergy on January 18th, 2015. She had become extremely sensitive to latex proteins, the same proteins that are in low-protein latex gloves. Kara didn't have to wear the gloves. She only had to, it was inborn, so all she had to do was have it, okay, sorry. I had to bury my sister. It was very hard for me because last weekend was her birthday, and I had to take my mom, and it's a devastating thing to do, is to bury a child. However, I brought myself together, and because I need to save myself and my children from exposure to latex contaminated food here in California, the preventative loss of life due to latex allergy is actually devastating. Like healthcare workers, those working in food industry are susceptible to latex allergy. I understand that latex gloves are less expensive. So why would anyone choose the more expensive and dangerous, life-threatening latex kind? I don't understand. But I feel I have a duty to protect people from developing latex allergy and educating limiting exposures. This is personal to me because it's a matter of life and death. I support SB 677. Please help California safer for all. These are my children here. I just want to hold up really quickly. And they all these 3 have the latex allergy, the same as my sister. And this is last week when I visited my sister, and hopefully this will be after when we pass it. Thank you so much.
Elizabeth can speak.
Thank you, Senator Allen. My name is Elizabeth Spitalny, and my son Oliver Lee could not be here today to testify because of the dangers of natural rubber latex. My son is 19. 3 years ago, a latex balloon popped, and he had an undetected latex allergy. He went into anaphylactic shock. I got him to Santa Monica UCLA just in time, and his life was saved. Since that day, he has to carry on his person every moment this amount of rescue medication. He has no other allergies except overexposure to natural rubber latex. He can't eat at restaurants. If he walks the dog around the block, he still has to keep this in a messenger bag so he can stay alive. He's 19 years old. He's in college. I will just be very brief. Latex is a hidden allergen. It transfers to food handled by anyone who uses a latex glove. It's on contact. I would like to share with you when Connecticut passed a ban on latex. I would like to read this to you. In the hearing, Connecticut Representative Prashad Shrivasan, a board-certified allergist, asked members of the Malaysian Latex Promotion Council one simple question. If I am allergic to latex, am I safe with your gloves? And their answer was no.
I apologize, we're going to have to end it right.
Thank you.
Okay, thank you so very much. Okay, thank you. Other witnesses in support in the back microphone? No? All right, what, oh, yes.
Michelle Navarrete, I'm a constituent of Senator Stone. Latex allergic. I developed the allergy using latex gloves in food service, and now 2 of my 5 children have it as well.
Thank
I
you.
support this bill.
Thank you. All right. Any other witnesses in support? Yes.
Oh, that's Deb. Who's blind.
Hi, my name is Michael Marlin. I live here in Sacramento. My wife is latex allergic, and so I am my unofficial occupation is latex cop, and I support this bill.
Thank you. Thank you. All right, and yes. Name and
And
support.
my name is Deborah Scott, and on behalf of both myself, but the No Latex Support Group, which is a global group of over 1,500 people severely allergic to latex, I wholeheartedly support this bill. And for the sake of the 50 plus EPIs that I've used and the 5 times I've completely stopped breathing, please support the bill.
Thank you. All right.
May I offer one
Seeing it-
more?
I apologize.
Okay.
So, all right. Seeing no other witnesses in opposition? Seeing no witnesses in opposition, questions from committee members? Is there a motion? Okay, so that's a motion from Senator Mitchell. I think your witness made a compelling point. Would you like to close?
I do appreciate, and I appreciate you guys for coming up and for being a part of this and making me aware of this enormously important issue. Thank you. Thank you. And thank you to the committee.
Yes, and I want to thank you I know you've had to wait a very long time to make your case. Hopefully, we're going to have a very positive result for you very soon. All right, the motion has been moved by Senator Mitchell. Motions do pass to appropriations. Secretary, please call the roll.
Hand?
Aye.
Hand I, Stone. Stone I, Durazo. Durazo I, Grove. Grove I, Hurtado. Hurtado I, Leyva. Leyva I, Mitchell. Mitchell I, Monning. Monning I, Rubio. Rubio I. 9.
Thank you, members.
Okay, the bill's passed 9-0. Oh, you got it. Okay, 9-0. All right, thank you. I see Senator Umberg.